ਹੈਲੋ ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਕੀ ਹਾਲ ਚਾਲ। ਅੱਜ ਦਾ ਸਾਡਾ ਟੌਪਿਕ ਹੈ ਐਵੀਡੈਂਸ ਬੇਸਡ ਪ੍ਰੈਕਟਿਸ। Evidence based practice is the using of best available evidence available to guide clinical decision making. Before the evidence based practice, research conduct on the basis of nurses' experience and scientific evidence of the patient outcomes. In nurses' experience, when there is lack of evidence in early years, then nurses research conduct on the basis of nurses' past experiences, which is major weakness, and loss of knowledge is major barrier. In scientific evidence by patient outcomes, when there is lack of advancement, then the patient outcome is believed to be evidence of the research. So that's why we need evidence-based practice. Another definition of evidence-based practice in nursing is the process of appraising and applying the best evidence from nursing and medical literature to improve the quality of critical nursing practices. Steps of evidence-based practice. Formation of clear question based on clinical problems. Formulation of question is useful to improve nursing profession or clinical profession, which reduce risk of patient care or risk of intervention decrease and improve the quality. First step is finding the clear question. It may be based on problem-based source, example increasing the risk of SOR, and second knowledge-based source, conference, journal, theoretical article, example infection in DVT. PICO model help in making evidence-based practice, in which P means population, I mean intervention, C mean comparison, and O mean outcomes. Step 2. Literature review to search best available evidence. Once clinical question selected, the researcher should explore the relevant literature review through clinical studies, meta-analysis finding, and other expert opinion. For example, self-management strategies are more effective than medical care alone for improving the health status, quality of life, and occupational functioning in coronary artery patients, in which P represents the client with coronary artery disease, and I is the self-management strategy, which is intervention, and C comparison with medical care, and outcomes are occupational functioning and morbidity. Step 3. Analyze evidence for its weakness and strength. Analyze the evidence, strength and weakness by focusing on specific terms like cost, duration, need of manpower, and other sources. Check it through the rating scales. Step 4. Select the best evidence for clinical problem. Use the best available evidence which improve the patient health and increase its value. Step 5. Evaluating the efficiency of evidence. It based on internal study, external study, and peer assessment. Purposes of evidence-based practices. To make profession with scientific sound, or to eliminate existing risky practices, and to improve quality of patient outcome, and to improve cost-effective nursing care. For example, time, money, and expenditure. Barrier of evidence-based practices. Contraindicatory information in literature or lack of professional ability to critical appraise, like research study method, study journals, or there is a lack of time, work pressure, or priority of patient care, lack for organizational support, and lack of confidence, lack for continuing education in nursing, etc.